Okay, I think we're on. How you doing, Dr. Lowe?
It's
And
a
good
pleasure to
evening.
be your counselor. Thanks.
No, thank you very much again for joining us, and good night. Good evening to everybody who are joining us on Facebook. Thank you for taking time to be with us. And Dr. Lowe, I'd mentioned just previously before we got on, if there's someone who I admire so much for what you've done and really stepping up during a crisis in the community, I see you on with Mayor Brown on CP24 doing press conferences. I see you in council. I see you in Mississauga. So you're really doing a duty for the community. How do you keep up with all your obligations during this difficult period?
Well, honestly, Councillor, thank you for the support and the kind words. Honestly, I'm well supported, certainly by council. We've had tremendous support from our regional council in the work that Peel Public Health is doing, and that means that my team can focus on the essential work of controlling cases and addressing outbreaks and all that other work that we're trying to do to keep the community safe. And at home, I'm well supported by my wife and my two kids, who understand that Daddy's a little busier than usual this year, but are always there when I get off my Zoom calls to spend some time for sure. So I thank you for your kind words, and thank you for the opportunity to speak with the community tonight.
No, thank you very much. So, Dr. Lai, I think before we get into it, I know we'll get a lot of questions, but I think, more importantly, everyone's thinking about Halloween. I know you talked to us about council earlier today. So what does that mean? Or can kids go trick-or-treating in Peel? Are there any guidelines, or simply we have to celebrate in a different manner this year?
Yeah, Councillor Medeiros, we looked at this, and certainly I think the provincial chief medical officer of health issued his recommendation with Peel and Brampton being in a modified stage 2 at this point in time. Traditional trick-or-treating is not recommended. And now I've had lots of discussions with my infectious disease colleagues. I certainly recognize that from a scientific basis and done under ideal conditions, trick-or-treating is fairly low risk, right? At least if you're staying outside the house, you're sticking with your family unit. But I think the challenge is that we do know that nature sometimes has other plans. And especially last year, I think everyone remembers last year was a very rainy Halloween. And I remember even with my own two kids, we ducked into a number of people's houses while in our neighborhood while it was raining. My daughter needed to use the bathroom sometimes, so we'd duck into people's houses there. And there are lots of people congregating out and about in the streets. So, just given that we're trying to really limit non-essential interactions at this time, just given that we're trying to stop a disease from spreading from person to person, from spreading when people meet, I think it just means Halloween needs to be celebrated a bit more creatively this year, just as with everything else that we've done in 2020. So no trick-or-treating, but let's see how creative we can get to make the most of the holiday and keep the Halloween spirit going.
Oh, well, thank you, Dr. Lowe. And we know that, some of us have to do some of these sacrifices, but it's also an opportunity to do something special with our kids. And, that's Halloween is special to me. It's my birthday. And so I'm going to be celebrating in a different manner, but still looking forward to celebrating nevertheless. So Dr. Lowe, we earlier, Brampton moved into modified phase 2 of the province's Ontario Recovery Framework. This is not what we all hoped for, but it was a necessary step for everyone's health and safety. So what does that mean, a modified phase 2?
Absolutely. So as you know, Councillor Medeiros, modified stage 2 just means that the province has decided to bring in additional restrictions in Peel, as well as in Toronto and Ottawa, and now in York most recently, to limit the spread of COVID-19. And I think some of the decisions that the province took in terms of those restrictions, some of them were based on our own recommendations in Peel. I think over the last couple of months, especially since we entered stage 3, I had been publicly speaking about social gatherings and how those were driving a lot of our cases. And when I say social gatherings, it's literally the gamut from really small social gatherings up to really large social gatherings. We've seen weddings, and weddings are one of the difficult ones. We've had so many exposures at weddings in the region of Peel. And so if anyone's thinking of getting married out there, now granted our banquet halls obviously are limited now by the new stage 2 guidelines, But the real challenge we were seeing is that there's a lot of pressure to attend something like a wedding, something like a 50th, 60th, a milestone birthday celebration. And so people were still attending even when they had really mild symptoms and it turned out to be COVID, and then they would end up exposing everyone at the gathering. So social gatherings are one of our drivers. Certainly workplaces were one of our drivers. And we also know that household transmission is a huge driver for us in our region. And if you just take a look at the way Brampton and Peel as a whole are, this isn't downtown Toronto. It's not a lot of single people living in condos. There's a lot of families here. There's a lot of multiple families that may be living under one roof, and also a lot of people who are maybe sharing a house or living together in houses to make the most of things. So we have a lot more occupants in our homes, which means that when COVID-19 gets into homes, we're seeing a lot more household transmission. So anyway, going back to your specific question, Councillor Medeiros, that meant that we were always continuing to see consistent but high rates of transmission in our community. Luckily, it was all within known clusters up until the backlog started to limit our ability to really make sure that we were absolutely certain. But in general, the province decided that to reduce the amount of contacts and interactions we were having, that they would bring in certain restrictions, some of them in line with ours. We were like, we need lower consistent social gathering limits. We need to have banquet halls and wedding venues revisited, and others that reflected the situation in other communities, such as indoor dining, gyms, which, as you all know, there's been some fairly public outbreaks in settings like that, both in Toronto as well as in Hamilton and other places that led the province to put those measures in place. So it's a whole list, and certainly it's available on the province's website to go through, but it ranges from discontinuing indoor dining to gymnasiums and fitness classes to closing things like cinemas and museums and the rest of those things, all in a bid to essentially reduce our case numbers and limit interactions to help stop spread.
Thank you, Dr. Lowe. And for everyone joining us on Facebook, please send us your questions. You can send your comments or questions for Dr. Lowe, and we'll be happy to share them. This is an opportunity for you to ask Dr. Lowe directly any concern or question you have. So my first question of the night is from Jasmine Sahi. Dr. Lowe, how is Region of Peel, how is it able to continue to contact trace COVID-19 cases when Ottawa and Toronto can't?
So Jasmine, it's a really great question. I'm happy to answer it. So again, our transmission patterns are different from Toronto and Ottawa. What we're seeing and what's driving a lot of our transmission is outbreaks in large workplaces and outbreaks in large households, as I said. And so what happens is we're not seeing the broader differentiated spread into the community that Toronto and Ottawa saw, especially around their nightlife districts. And as you know, like Toronto's got all sorts of nightlife districts. Ottawa has places like Byron Market or Elgin Street. So they were seeing cases that were just where the contacts became much more difficult to trace. It was, oh, I went to this restaurant, these bars, and I went to, this after bar night spot, and I don't know who my contacts were or how they were. So that makes it a lot more difficult to contact trace. Whereas in our case here in Peel, we've been fortunate because firstly, our cases, while they haven't spiraled completely out of control, they have gone more on a linear increase. If you recall, at the beginning of September, we were around 50 or 60. By the end of September, we were around 100. And then now we're getting into about the 140, 150 range, which suggests to me that we may have brought restrictions in just at the right moment for us in Peel. But what it also means is that because we're not seeing the massive case growth that they saw in Toronto, and additionally, because a lot of our cases are still in those clusters within workplaces and within homes, that makes it a little bit easier for us to contact trace. I think the last thing I would say, and I'd be remiss in saying this as well, we have a great team at Peel Public Health. These are people that have gone above and beyond for the last 11 months. They're the ones that give me the confidence to stand up here and inform the community as I do. And I know our case managers and our contact tracers, our outbreak investigators, infection prevention and control specialists, our epidemiologists. I'm going to forget, but basically the whole team at Peel Public Health is is really working significant hours and have made significant personal sacrifice to make sure that we're keeping this thing under control. And we've also tapped into the province and other health units for assistance and support to make sure that we're keeping things under control. So, for example, I'll just give a quick shout out as well. We've gotten support from Wellington, Dufferin, Guelph Health Unit. We've got support from Niagara. Just recently, we've gotten offers of support from North Bay, from Porcupine. So really, the whole province, similar to Toronto and Ottawa, has also pitched in to help us keep this under control. And because our picture is a little different than Toronto and Ottawa, we've been able to keep it on knife's edge. And I'm hoping that we'll be able to push cases down and make sure that we're still able to keep this under control.
Thank you. And Dr. Lowe, I agree with you. We really recognize the fantastic work that Peel Public Health, everyone involved have been, I know as a counselor, when I get inquiries, and a lot of these inquiries are from businesses, and we know that that's their livelihood. The answers and the support and the reach out is immediate. So, kudos to everyone associated with Peel Public Health and across the region of Peel, everyone from I've encountered, commissioners, staff, everyone's doing a yeoman's job. We have a question here from Julia Rubin. I was wondering how safe is it to order takeout? Should I be concerned about one of the cooks potentially contaminating my food if it turns out later that they are sick?
Julia, this is a really great question. And one of the neatest things about this disease is that we are essentially, so when I was in medical school, they have this textbook called Heyman, which is basically the Encyclopedia of Communicable Disease. And inside there, every disease known to humankind, there is a disease control chapter. And you basically read through it, and that's what. So one of the most fascinating things is that we are all front seat watching the disease control chapter for COVID-19 being written in real time. And so, as you know, early on in the pandemic, there was a lot of question around, can this be transmitted through things? Can this be transmitted through fomites? And now that we've actually investigated, and this is the team at Peel Public Health, together with our partners at the province and elsewhere chipping in, we've investigated over 12,000 cases of COVID-19 in Peel. It's becoming very clear that this is transmitted by people, not by things. And so, as you know, back in the early days of the pandemic, we were saying, well, just as a precaution, make sure you're wiping down your groceries, wiping down your takeout containers, etc. It's becoming less likely that that's a form of a means of transmission. And if anything, it's actually defeated by one very simple maneuver, by making sure that you're washing your hands. So you get your takeout containers, you get your food out, put it on its plate, throw the takeout containers out, wash your hands before you eat, and you're good to go. What is interesting though, and this is something I will highlight, is we've also learned a lot about aerosolized transmission. And so everyone knows that the 2-meter rule comes from the idea that you're infected by droplets from someone infected with COVID-19 falling within about a 2-meter radius of that person. And that is the majority of the times where COVID-19 is actually transmitting. But we also know that in very specific instances, COVID-19 can spread beyond that 2 meters and also linger in the air rather than drop to the ground for longer. And that's usually in poorly ventilated, dark, crowded spaces. So as long as you're basically making sure you're maintaining a 2-meter radius and wearing a mask where you can't do that effectively, and you're also avoiding crowded and closed spaces with lots of other people, you'll be able to manage your risk fairly well.
Thank you, Dr. Lowe. Another question by Jasmine is regarding flu shot. How will getting the flu shot impact the pandemic?
So the way the flu shot impacting the pandemic will do so in 3 ways. First of all, it actually allows us to reduce the burden of influenza, both overall cases as well as severe cases that might need hospitalization and need to seek healthcare. So if you actually get the flu shot, either you won't get flu if you're fortunate, or you might get a milder case of the flu, which means that you don't need to see your doctor, or you don't need to go to the hospital. And that's critical during a pandemic because we actually want to make sure that our hospital is open and able to surge in case COVID-19 surges. The second thing is that it actually makes it easier if you do get sick for us to figure out what you might have. So even if the thing about the flu is that many of the symptoms mimic COVID-19. That's one of the challenges with COVID-19 is that the symptoms kind of look the same at the initial part. But if you have a flu shot, it makes it less likely that what you have is flu. Now, granted, it's always a possibility, but it's less likely, which means we can try to rule that out as opposed to the rest of the things we're seeing. And the final thing is that when you get your flu shot, you're actually also protecting other people. So if you have the flu vaccine, one thing we do know is that it helps to protect you, especially if you're working with or meeting with vulnerable populations, such as infants or like children or elderly. or people with pre-existing medical conditions. And those people need all the help they can get as well in trying to battle both flu in the fall and winter, but also COVID-19. So I think there's a lot of reasons to get your flu shot if you're able. I will say as well, we know that there's unprecedented demand for the flu shot this year. The province has ordered more flu vaccine. Apparently, according to our provincial partners, they're still ordering a ton of more flu vaccine. And for us in Peel Public Health, as soon as it shows up in our offices, we are getting that stuff off our shelves and out to physicians' offices. But just like snow tires after a snowfall, you might want to plan ahead. Just make sure that you're, and please be patient. We appreciate your commitment to making sure that you get your flu shot. It just might take a little bit longer than usual this year, but we'll make sure that we'll try our best to make sure that everyone's got something.
And Dr. Lowe, you had mentioned, I believe, in council today regarding clinics. There are going to be a couple of clinics around Peel.
Absolutely. So thank you, Councillor Medeiros. In fact, if you visit peelregion.ca/flu, you'll get a little bit more information around what we're planning. We have a number of clinics planned for people who don't have OHIP coverage and also for children under the age of 5. And just to be clear, when we say children under the age of 5, anyone under the age of 6 months is not eligible for the flu shot. They still have protection from their mothers, so that segment doesn't get a flu shot. But so basically 6 months to 5 years, and also people who don't have OHIP coverage. We're going to be running some limited flu clinics at Fairview Clinic, which is in Mississauga, as well as at 10 Peel Center Drive. And so peelregion.ca/flu, there's all sorts of information on there, and you can check that out. I understand as well, we're working on an online booking system, which hopefully will be available in the coming weeks.
Now, thank you, Dr. Lona. That leads me to the question around testing. And I know that the province changed the way that we do testing. I myself would go to South Fletcher's, very close to where I live, and I would do testing, but now you need an appointment. Can you talk to us about the process currently, and why did they make the change?
So there's a number of reasons, as I understand it, and as you know, our provincial partners are the folks that are in charge of the testing system, through the Ontario Health provincial agency that oversees this. But first and foremost, I think when we were coming down off the first wave back in the spring, the previous testing criteria was anyone who needs a test gets a test. And in general, you want to do that when you are coming out of a wave, as opposed to where you're seeing a situation like ours, where you're seeing continuing high levels of activity. And so the change of the criteria from everyone getting a test to focusing on really people who are symptomatic and people who may have been exposed to COVID-19 was part of the reason why they actually moved to an online booking system. It allows them to pre-screen as people are booking whether they actually need to have the test. And it allows them to also make sure that only really the people who absolutely need to get tested are trying to access the system as opposed to just showing up, sort of thing. Now, I recognize that poses some challenges and has posed some challenges. And I think it's incumbent upon me to say this at this point in time. If you have booked an appointment and you've gotten better and you don't need a test anymore and you didn't have an exposure to COVID-19, you may be fairly low risk, right? I think I would put it this way. Maybe I'll just clarify this. So if you have symptoms, absolutely get tested. If you were someone who just kind of booked it and just said, well, I just need an appointment kind of thing, and you no longer need that appointment, I encourage you to cancel it. And so that way someone who actually might have symptoms or might have been exposed can actually access that facility. But in general, the hope is that by moving to an appointment-based system, by moving to specific criteria around who can get tested, we'll be able to more quickly pinpoint and identify who's got COVID-19 in our community and where it's spreading, as opposed to testing everybody and anybody.
Yeah, no, thank you, Dr. Lowen. And I think the point around that as well, if you do have a test and you do have an appointment, and if you don't plan on going, please think about other people who could benefit from the test. So we have a question from Arshdeep, who would like to know, do you think current regulations will help improve things by Christmas so we can get together?
Steve, man, I'm a huge fan of Christmas. I usually love getting my Christmas on as much as I possibly can, and obviously all the winter holidays as well. We know that many cultures and faiths celebrate in December and through the winter months. I am hopeful that with the restrictions that are in place, that we'll be able to bring our case counts down to something that's manageable. That said, we have to remember that we're in a pandemic, and part of the reason why we ended up back in a modified stage 2, is that I think there was a lot more close contact going on than perhaps was sustainable, just given the fact that we still have COVID-19 in our community. So while I'm hoping it'll bring things down so that we can have somewhat more of a normal Christmas and maybe not necessarily caught where we are right now, I think we will still be celebrating in probably smaller groups and probably with certain precautions, as we want to make sure that we're still keeping this under control even throughout the winter months and throughout the flu season as well.
Okay, so it's something to look forward to if we can all work together and maintain discipline, and again, wear a mask, wash your hands, social distance, etc. So we have a question from Suyog Pradhan, and my apologies again for mispronouncing. If vaccines are released, will it be available to everyone who comes in, or will there be groups that are prioritized? If so, who would fall in these priority groups? Martin, Dr. Lowe, thanks for hosting these Zoom calls, highly informative. So how are they going to prioritize vaccines?
So again, thank you very much for the question as well, and thanks for the support. This is an active topic of discussion at the federal table, but from my professional opinion, there's always, especially when you release vaccine, even with something like influenza, which we have a universal influenza immunization program, in other jurisdictions, what they do is they do prioritize flu vaccine. And so I think a lot of it will be really focused once we get a COVID-19 vaccine, it'll be focused on who we know are the most vulnerable and who we know have had the most severe presentations of this illness. And so far, all of our data points to people over the age of 60, over the age of 70. It points to people who have medical conditions, particularly chronic medical conditions like cardiovascular disease or cancer or high blood pressure, diabetes. And it also points to people who work in certain high-risk professions, particularly if they're essential workers or if they're healthcare workers, all these other pieces. And it's important to remember as well, there is an intersection as well between a lot of the essential workers and the fact that many of those positions are filled by people who identify as racialized minorities or as new Canadians. So there's a lot of questions there in terms of the transmission patterns that we've seen right now. I think all I can say at this point is that the federal government will look at all the data, and because there's only going to be a limited supply of vaccine, they will try to make decisions based on starting with probably the most vulnerable and working their way down to everyone else. And ultimately, I suspect in the long run, especially given just how easily this disease spreads, the hope will be to start producing vaccines for COVID in the way that we do with flu, so that someday there will probably be a universal COVID immunization program in the way that there is for flu, so that we can try to get back to some semblance of a normal life.
Great, thank you, Dr. Lowe. Question from Puneet Bains. Puneet Bains, how is transmission different in the region of Peel and Toronto?
So Puneet, it's a great question. I get asked this question all the time. And a lot of it really, first of all, this is the essential value of local public health. And that's one of the things that has been demonstrated this pandemic, is that for us in Peel Public Health, we speak for Peel. Like, this is what we're seeing in our communities in Mississauga, Brampton, and Caledon. And this is how we understand how things are unfolding in our community. Toronto Public Health speaks for Toronto, and York speaks for York. And basically they understand. It actually helps you really get a bird's eye view of the community and what you're seeing. So if you think about Peel and you think about our community, as I said at the beginning, we have a lot more larger houses with a lot more occupants. It seems that we socialize a bit differently here as well. There seems to be a lot more friends getting together at other friends' houses, families getting together at other families' houses, people that might go to a place of worship and then go back to someone else's house together after the celebration. And while there are certainly districts where there are nightlife, it's not to the same extent of, say, downtown Toronto, where they've got a King West or an Ossington or, those sort of places, similar to Ottawa at the Market. And so what we've seen, at least in our transmission, is that it's mostly households, and it's actually households, people introducing it to households from workplaces. And then that goes to the other part of our piece. If you think about our community, especially in Brampton, a lot of our employers, a lot of our places people work, big distribution centers, big factories, manufacturing plants, warehouses, call centers, right? Like these are the kind of places that we tend to work in here out in the suburbs. I say we in the sense of like us as a community. So then what you're seeing then, of course, is you have transmission in these settings where if precautions aren't being taken, people are crowded and confined, and you're seeing transmission happen there. And then you're seeing it get into the houses where there's a lot more people to infect. And then that's where the social gatherings come in, where if you're having people meet outside of their homes, et cetera, you're then seeing transmission there, which is why we're not seeing the same pattern, in terms of bars and restaurants. We don't see the same sort of go to a, work all day till 5:30, head to a bar, head to a couple, restaurants, then head to a bar afterwards or whatever that you're seeing in Toronto, which led to a lot of the differentiated community spread that they had there. We're seeing a lot more family gatherings. We're seeing a lot more social gatherings. We're seeing a lot more workplace, and we're seeing a lot more homes. And that's what's kept our contact tracing somewhat manageable. And that's also what's helped us at least target different interventions in our community as it pertains to our community picture.
Great, thank you. Next question from my good friend Myrna Adams, who just happens to be the president of Brampton Senior Council. And I know she's been a strong advocate, especially on improving testing and improving sort of our response around COVID, specifically around the impact on seniors. Her question is, Dr. Lowe, is it true that Brampton has the largest number of infections in Ontario? If true, why is this happening?
So Myrna, I haven't looked at, I'll fully admit, I haven't looked at the recent provincial numbers across the province. I will say that Peel region as a whole is up there with Toronto and Ottawa in terms of the highest number of active cases, as well as the highest incidence rates. Like I said, what is interesting about our picture is that even though our incidence rate is high and the cases that we're seeing are high, they're happening in known clusters. So basically people are getting sick at work or sick at home, and then they're transferring back and forth, as well as some spill out into social gatherings. So there's this cycle between workplace, social, and home that we're constantly trying to catch up with. And that's actually what makes it a bit more of a reassuring picture at this time, although it is evolving. We're clearing through the lab backlog that the province had, but it is a bit reassuring, as opposed to some of the more undifferentiated spread that other communities were seeing. So it's for that reason. It's just the same cycle that's been driving our cases pretty much since day one. We have a lot of people in Peel region that can't work from home, that have to go into work, and if precautions aren't followed or taken, can result in spread there. And as I said, once it gets into homes here, it's not just one or two people living together. It's, it could be up to 10 or 15, especially if multiple families might be living together, or multiple people are sharing a house or space together. So that's why we're seeing higher cases, and that's why we're seeing a different picture in our region.
Thank you, Dr. Lowe. Maria Moraes would like to say, Dr. Lowe, thank you for your leadership, ! Question by Marco Gomes. Good evening, gentlemen. Why is the COVID test taking longer to get a result in Brampton than in Toronto? I tested yesterday morning and have not gotten my result, but friends in Toronto tested yesterday afternoon and already have the results. And I know Mayor Brown has been very vocal also about this issue. So why is testing, we're waiting longer in Brampton?
Yeah, so Marco, it's a great question. And so, like I said, Ontario Health is the lead agency on testing, and certainly we work with them in very close partnership. My understanding is it's just a matter of how the test gets processed. And so in Toronto, many of the hospitals have the capacity to process tests on their own. Certainly that means that they're actually able to get results back faster, especially if it's all done in-house. My understanding is that Brampton Civic has a significant capacity, and they have done a number of tests, but they have limited capacity in-house. So many of the tests do get shipped out into the provincial system and then are done elsewhere. And so certainly I know Mayor Brown has been working with the provincial partners to try to figure out what's a better way to do that. From my perspective in Peel Public Health, I would welcome it if there was more capacity and ability to turn things around more quickly, because that would allow us to stay on top of things and start contact tracing faster if someone were to test positive. So hoping you'll get your test results soon. And I know that our provincial partners that we talk to, they're certainly aware of it, and I imagine they're working to bring additional capacity online.
Great, we look forward to that. Question from Devinder Baines. How does cold weather affect the spread of COVID-19?
So Devinder, it's interesting. As I said, we're learning about the disease in real time, writing the disease control manual. There's increasing suggestion that the droplets might linger a bit longer in drier, colder air. That's similar to other respiratory viruses, similar to influenza. Previous to this, there was questions around the nature of the seasonality of this virus, particularly given that there are many other tropical countries or countries with warmer, drier or humid conditions that we're still seeing significant surges. Countries like Ecuador, Peru, India, Brazil, those all come to mind. But as this has gone on, though, it is becoming very clear, and especially with the recent surge that was seen in Western Europe, as well as in some of the Midwestern states in the United States, that weather and climate may be playing a factor similar to other respiratory viruses. And now, whether that's related to the fact that more people are heading indoors, they're turning on their HVACs, they're staying in confined places and not following precautions with people outside their households, or whether it's related to a behavior on the part of the virus, that's still being teased out, but it is certainly a hypothesis that's actively being explored.
Great. Thank you, Dr. Lowe. Question from Allison Jane. I have a negative COVID test. Can I visit a loved one in a nursing home if they are end of life and there is an outbreak there?
So Allison, it really depends. Well, first of all, I think at this time, there are limitations on long-term care homes in the region of Peel. I'm trying to remember exactly what it was, but whether it's limited to outdoors or indoors. But I think that's something I'm going to look up right now while we're chatting, just so I'm absolutely certain. But I wanted to talk more about the nature of a negative test. It really, in terms of exiting self-isolation as a whole, it depends on the reason why you got tested. So if you got tested because if you had symptoms, or if you got tested because you were exposed to someone who was COVID positive, we ask that you finish the requisite isolation period. 10 days if you had symptoms, 14 days if you were exposed. And if you were tested because you wanted to visit someone in a long-term care home, then I think you need to make sure that you abide with Directive 3, which is the directive that essentially speaks to visits at long-term care homes. And I'm going to get you an answer for that as I have a double check of that piece there, because I do know that some changes have been made in terms of the visiting policy for places that are in modified stage 2.
But Dr. Lowe, for those who are looking for those type of, and we sometimes politicians, we get these type of questions, is the best thing to go on Peel's Public Health website and send in their questions?
Absolutely. In fact, the best way to do things are you could go to peelregion.ca/coronavirus. You can go to ontario.ca/coronavirus, because they'll have details on a lot of these are provincial guidance and documents, so they'll have that there. And if it's still kind of difficult to understand on the website, our call centers are open at 8:30 to 5 every day, and I believe the number is 905-799-7700. And I did just look this up on our website. The restrictions are visits are restricted to essential visitors and caregivers, and then short-term and temporary absences from long-term care homes are allowed for medical or compassionate reasons. So I would encourage the previous questioner to contact the long-term care home to figure out how to get registered as an essential visitor or caregiver, and depending on the nature of the test, if they're able to exit self-isolation, to see how they can visit their loved ones in long-term care.
Good, thank you. Now we have a question from Ivan Macri, who's very involved in the community, especially around crime and safety issues. Thank you, Councillor Medeiros, for the opportunity. Dr. Lowe, can you talk to us about the COVID-19 app and how does it work? And it's interesting, Dr. Lowe, and I find that a great question, because I was just on a media interview yesterday and they talked about COVID-19 app. Are we promoting it? Why aren't we doing more sort of promotion around it? And do we have any numbers of how many people are using the app in Peel?
Absolutely. So Councillor Medeiros, we don't have any numbers on Peel specifically, but I do know that apparently, the Premier always talks about how many people have downloaded the app. I think it was like something like 2 or 3 million people so far. So I don't know if that's for all of Ontario or for all of Canada. Either way, the more people that have the app, the better. In general, the way this app works is it's all Bluetooth. It doesn't record anything around GPS. I actually have the app myself. It doesn't ask you any questions about who you are, what you are, nothing identifying. Essentially, it's your phone. And then basically, the way it works is if your phone is in proximity with someone else for a certain period of time within a certain proximity, it will register that as a close contact. And then later on, if later, like say 6 or 7 days later, one of you tests positive, you can actually go to the app, get a one-time key to enter in your results, and then it will actually send a blast to anyone who had been recorded as a close contact within that period to advise them that they had been exposed to someone who had tested positive for COVID-19. It's an extra layer of protection. It helps us in public health because people may get the information before we actually are able to finish the case management and contact tracing. And then it's always really great when we call people and, and just say, hey, how's it going? They're like, oh yeah, I've been isolating. It's like, perfect, you need to isolate, kind of thing. So that's where it adds a little bit of a protection, a little bit of an added layer of protection, and also helps to stop the spread of COVID-19.
It's interesting, that perspective, because I also have the app, and I once, probably around a month ago, I would have got sort of the notification, and my first sense was there was terror that I would have been close to someone who was possibly contacted and who has the virus. And I essentially made an appointment, or not made an appointment. I went the next morning to our drive-through here at South Fletcher's. I tested negative, and then I followed up 2 weeks later just to be 100% sure, and negative again. But one thing is interesting going through that sort of those couple of weeks, that period, is around sort of the social stigmatization of people admitting that maybe they could have come in contact with someone, or possibly they could have it. Do you notice sometimes that, what I find is that people maybe have symptoms, but they're afraid what the sort of repercussions might be, that they, similar to those people who don't want to go see the doctor because they're afraid to face that. Do you think that sometimes that might be, and why it's so important that people, if they have symptoms, that they go get tested and they report if they've been in contact with someone who has COVID?
Councillor Medeiros, it's a really great question. We know that stigma and discrimination have played a huge part in this pandemic. And so the first thing I would say to anyone, if you have symptoms consistent with COVID-19, and so that's things like cough, fever, shortness of breath, loss of taste or smell, all of the primary symptoms that have been identified and that are well understood now through all the research that's been done about this disease. If you have any symptoms like that, I absolutely encourage you to get a test. And I do this for I say this for two reasons. First of all, if you get a test and you test positive, you have COVID, and that means that in the event that you need to seek care, particularly if you have worsening symptoms, you're able to tell people, I got tested, I'm positive for COVID, I've been isolating, and this is why I think I'm worse and I need support. It makes it a lot easier for the physicians. They can take precautions. They'll always take universal precautions when they see you. But it just helps to expedite things if you're able to get a test. The second thing is we're only going to prevent the spread of this disease if we all do it together. And so if you have symptoms, you don't know one way or the other unless you actually get a test, whether you're positive or negative. And I think the really important thing there is that if you're positive, then you will then be, you'll then hear from us in Peel Public Health to figure out who you may have been in contact with and all these other pieces. We treat that information and we treat your privacy very seriously. We recognize that information that you're giving us is critical to our efforts to build out how you got it and who you might have spread it to, so that we can make sure that we're taking appropriate precautions on both sides. So it's important for me to reassure people that, and especially this is where actually, Councillor, a lot of the recent discourse around disclosure and transparency has me somewhat troubled, because the reality is that where there's a public risk, we'll absolutely let people know where the exposure exists, etc. But if there's no public risk identified in our investigation, we recognize that these numbers are not just faceless numbers. They're people. They're people who have COVID-19. They're people who are struggling against this disease. And they're people who, at least for us in our contact tracing purposes, are privileging us with their personal information so that we can trace the spread of the disease and make sure that we're keeping the community safe. So I want people to have that reassurance that if you talk to us, we're going to do everything we can to respect your confidentiality and your personal health information while we use it to keep our community safe. And it'll also give you peace of mind in the event that you need to seek care, that you'll be getting the care that you need for COVID-19.
Well, those are great points, Dr. Lowe. Question by Kimberly Nesbitt. I am high risk and I have to take my young granddaughter to a drive-through appointment to be tested prior to her surgery. Am I safe to be in the car while she is being tested?
So Kimberly, absolutely. If she is someone that's been part of your immediate household or essential support, someone that you've been in close contact with, if you have an idea where they've been in the last couple weeks, say they're in school or whatever the case might be, and the school things seem to be okay there, and she's asymptomatic, she's not spreading anything, she hasn't been exposed, and the only reason she's getting the test is because she needs to go for surgery, then you're absolutely fine to drive her at that point in time. And certainly if you're concerned, you can make sure you both wear masks. But again, really what this comes down to is making sure that when you are in close contact with someone, you want to make sure you have an idea, like who else have they been in close contact with? Who else have they let into their 2 meters? And provided they're well, and provided you have a good idea that they haven't really been in contact with anyone who's had COVID-19 or been linked to an outbreak of some variety, then I think you should you'll have confidence, at least in remaining in close contact with that person.
Nice, thank you. Another question from Simran Romatar. Thank you for facilitating this forum. Where are most of the COVID-19 cases originating from? I guess in terms of location, or maybe where do you find more transmission?
Yeah, absolutely. Simran, first of all, we have a geo-mapped map on our peelregion.ca/coronavirus, our dashboard. It actually shows rates of COVID transmission based on, it basically compares different neighborhoods to the overall average in the region, and it shows which neighborhoods have more individuals who may have tested positive for COVID-19. In general, like I said, we also have a weekly epidemiologic summary that shows where transmission is, and that actually over time has really shown that the bulk of our transmission is through household and close contact transmission, which is basically social and household. And we also have a significant proportion associated with workplaces. And then additionally, one thing that we've been seeing a significant increase in, at least since the summer months, has been an increase in travel related cases as well. And so that's why our advice has stayed the same. It's really been, making sure you're limiting your outside contacts, making sure you're taking precautions at work, when you're encountering anybody. And also why we're pursuing things like a voluntary isolation center to try to reduce household transmission for people who can't safely isolate at home. And that reminds me of the final piece of advice, which is especially around travel. At this time, the federal government still recommends against travel outside of Canada. We know that the COVID-19 picture in many parts of the world, especially in our neighboring country to the south of us, is significantly different than what we have here in Canada. And so if you do have to go abroad for any reason, make sure it's for an essential reason, make sure that you're taking precautions, and make sure when you return to the region of Peel that you abide by the 14-day mandatory federal quarantine on your return.
Thank you, Dr. Lowe. Quick hello to Philomena McGinnis, and thank you for joining us. Elizabeth Sargenson, thank you for these great Q&A forums. If we are caught in this vicious circle of transmission and Peel, how do we ever end the cycle other than awaiting a vaccine?
Well, Elizabeth, I think the vaccine is essentially, one of the more critical pieces to really helping to drive down, because the vaccine provides immunity, and maybe partial immunity or maybe some sort of immunity, but it allows us to go with confidence that either people will not be transmitting the disease, or they'll have a more mild presentation of the disease, but not have the severe presentations that would overwhelm our hospitals and our healthcare system. So a vaccine is crucial, I think, in the longer run of piece. And I think there's a lot of promise out of the vaccines that are being developed. But in terms of interrupting the transmissions, the things that we can do right now, and I think there's a ton of stuff out there. I mean, there's really no secret. This is a disease that spreads from person to person. And I think to the extent that we can limit our close contact between people, and one of the things that I'll share, I get a lot of emails. I hear from a lot of members of the community, et cetera. They're like, wow, you must be a huge introvert. I'm like, no, I actually really like hanging out with people. I actually really miss dinners and, happy hours and, visiting and partying and all this other stuff. Like, I mean, it's literally been a very bizarre year. I haven't done any of that. And I can actually share this. My friends who know me know that I'm a big social animal. I haven't seen some of my friends in pretty much all year. Like literally the last time I saw them was probably in 2019, because January, February came around, got back into the grind of things, and then the pandemic. So I haven't seen people since Christmas last year in person. But it's really interesting, because I think if you can adapt your life to still maintain your connections, but use the virtual platforms. And if you have to meet in person, if you absolutely have to meet in person for any essential reason like work, fitness, whatever, make sure you're staying apart. Make sure you're keeping numbers low. Make sure you're wearing masks, especially if you're indoors. I mean, these are all the sort of tips that'll keep you safe, and it'll also help to interrupt transmission in all of those different settings.
Well, it's really interesting, Dr. Lowe. One of the hazards of my job is that residents, as much as they understand there's a pandemic, there are those who really want to meet with me face to face about some resident issues. And as much as sometimes you tell them that we're during a very sensitive period, and even for my own health, because I do have high blood pressure and I'm trying to be very careful, sometimes people don't recognize the importance of us maintaining social distancing and so on. And but I do my best when I do meet with people. It's outside, keep a distance, and so I try to maintain it. But that is a challenge sometimes, certainly. And I know not seeing friends, that's been a difficult thing. I used to play soccer every Sunday mornings, and I think I haven't seen my friends in probably a year and so on. So it's been difficult. But very much we have to do that. Regarding the next question we have here is again, so my apologies. It is around Mr. Balwinder Dhaliwal. Councillor, are there flu shots available with family doctor? And you had already talked about that, that you're going to be getting them out to family physicians.
So I could talk about that, Councillor Medeiros. We get our allocation of flu shots from the province. They allocate them to each community via their health unit. And then once it's there, we actually have our family doctors have all put in different orders. A lot of them order significantly more than they may need. But we basically try to make sure that every clinic is treated as fairly as we can to try to get the supply that we have out there. The supply is rolling as the manufacturers produce them. They're giving it to the province, and the province sends it to us, and then it goes. So, again, there's a lot of demand this year for flu shots. So, to the extent that you can be a little bit patient, that will be that'll go a long way. Make a plan, call your family doctor, book an appointment a few weeks later, so that you can hope that there's some supply that's in at that point in time. Or call your pharmacies, make sure that they have it. The pharmacies actually get it directly from the province through a different arrangement. So there's lots of places, and I think if you're able to have the wherewithal to look and make a plan, I'll thank you for doing your part to make sure that you're also stopping flu in our community as well.
Great. Question from Karen Dancy. With respect to classes being closed in schools due to a COVID case, why are siblings in other classes not isolating as well? Instead, they continue to go to school and could infect their classmates. So I guess it's a situation where I guess one school is dealing with some form of outbreak and they take a decision, but they have siblings in another school from the same family. Is that sort of stuff that's monitored, or how do you deal with that?
So it depends on what the situation is, Karen. So if someone is a confirmed case, then what happens is their siblings we direct their siblings and their family to self-isolate. So for example, if you have a family, let's say they've got a student in grade 8, grade 5, grade 1, let's say one of those students comes back positive for COVID, all 3 of those students have to isolate. It's different when it's contacts. So for example, if you have a grade 8 student and they may have had a close contact with a student who is in their class, if that student has siblings, then those are contacts of contacts. And those, especially if that one student is well, we don't necessarily require them, we don't necessarily require the siblings to isolate at that point in time, even though the contact of the original grade 8 case needs to isolate. So it's different if the person is a case. So siblings of a case always have to isolate. Siblings of a contact, it's on a specific basis depending on the nature of the exposure. But typically a sibling of a contact, especially if that contact is well, it doesn't warrant isolation at that point in time. Now, of course, if that contact then becomes a case, then those siblings will have to isolate, obviously.
Thank you, Dr. Lowe. So Dr. Lowe, we saw the province, change the guidance around dance studios. And I know I've received some of my residents and constituents and who run, for example, gyms and so on. So they're a little perplexed on why dance studios, there was different guidelines and there was reversed, and how come not for gyms?
Yeah, I think.
Mel?
Yeah, thank you, Councillor. I mean, I think the question around dance studios is really fascinating one, because as you know, with a lot of indoor physical activities, particularly ones that require you to be more strenuous and actually, not, you may not wear a mask, for example, there can be a challenge, especially when I talked about that aerosolization that's out there. I think the province makes its decisions, and I think it made its decision, at least around dance studios. But overall, in terms of indoor fitness, physical activity indoors, that's a venue and a spot that, while we hadn't seen any transmission in Peel, we are obviously continuing to watch. As I said, we're writing the disease control manual in real time. We're obviously beginning to watch and look at certain outbreaks that are associated with such facilities. I think one that was particularly prominent in the city of Hamilton at a spin class is particularly instructive, but we've also seen in Ottawa and Toronto, those were things that drove the move into modified stage 2 in those communities. So I think when it comes to indoor fitness, I can't necessarily explain the recent change in the provincial government around dance studios, but I think more broadly, just at least from my perspective in Peel, it's a dance studio, among other indoor fitness facilities, are ones that we are watching with great interest, just given what other communities have experienced and seen in terms of controlling the disease in those settings.
It's interesting when we're talking about fitness, Dr. Lowe. I know my wife and I, we will try to do daily walks. And I know at Council in Brampton, we've sort of directed staff to sort of increase offerings for outdoor activities, and be it more outdoor skating rinks and so on and so on. And I know with the cold weather, how important is it for us to maintain physical activity? And notwithstanding, I know the mental health benefits, but is it safe for us to be continue to walking and maintain our physical well-being?
I think it's absolutely critical, to the extent that you can. And one of the questions I got asked at a similar forum as this was, well, if I can't go to the gym anymore, what can I do? And I said, one of the greatest things you can do right now is, if you're able, is to invest in a pair of running shoes, or invest in a pair of good shoes. And even just walking, running, or if you have a bike, getting on a bike, getting out there, those are all things that can continue to give you mental health and physical health benefits. And really, especially just given how difficult a year it's been, help to address some of the challenges that you may be facing. So it's really critical, I think, during this pandemic to make sure we're not taking things for granted, that we're taking every opportunity we can to keep ourselves healthy, and that will help us to keep resilient, both against physical challenges, but also against the mental challenges that continue.
Yeah, and regarding, I guess, mental well-being, and I know that there is supports that Peel Public Health does offer for those who may think that they're facing or experience some mental health challenges. Is there, I believe there is a number that they can call, in which if they require any supports, that they will be directed to some supports. Is that correct?
Absolutely. Well, it's actually not through Peel Public Health, but it's through it's through the Peel Dufferin branch of the Canadian Mental Health Association. And so certainly you can always reach out to them. I've got their number here in my notes. It's 905-451-2123. So again, it's 905-451-2123. And also they've got a crisis support line, which is at 1-888-811-222. So that's another place that people can seek help, especially if they're having challenges during this time right now.
So we have another question around barbershops from Sunny. I believe his question is, are barbershops going to be open? I think I'm not sure if they're currently open right now under the guidelines.
So right now, under the rules of a modified stage 2, personal service settings are able to be open, provided that the mask does not need to be removed for the service that's being provided. So yeah, if you're getting a haircut or whatever the case might be, there's certainly that. But anything that involves removing the mask is forbidden under the modified stage 2. So I think you can get a haircut with a mask. So that's probably where you can go.
Now, a question that we have here from Puneet regarding people partaking in anti-mask movements along with anti-vaxxers when a vaccine is introduced. wouldn't it still take very long to overcome COVID-19 pandemic? So I guess, we hear a lot about when a vaccine is introduced, not to the sense we're out of the woods, but it's still going to take a while for us to get to that point in which people will recognize life as somewhat normal again. Can you maybe speak to some of those timelines?
Absolutely. So, Councillor Medeiros, we're hopeful, at least with the way and I think there's a few things I'll touch on in terms of a timeline. We're hopeful that a vaccine, especially with the way the trials are going, even despite them being paused, and those are for standard safety procedures just to make sure the vaccine is safe and that it didn't cause the side effects that may have been seen during the trial. So there's a lot of work going in to make sure that there's a vaccine that is effective and safe. I anticipate that we'll probably see an approval of a vaccine, hopefully by early next year, beginning of early next year, or by the spring at the latest. And then after that, you're going to have to see them ramp up production, obviously more mass production of the vaccine and all those other pieces. So those are pieces that that will hopefully push us to maybe starting to see the first vaccine roll out in the summer next year, if all goes well. That said, in terms of this is not going to be a case where once the vaccine's here, it's all done. The reality is COVID-19 is still going to be circulating in the community. And as we're basically similar to what we did with the closures in the spring, as the case numbers go up, you want to make sure that you're putting restrictions in place. And then as the case numbers are going down, you're taking that opportunity to build up capacity. So the idea is that you're going to be vaccinating and the number of people that are immune is going to be rising at the same time that you're trying to lift or reduce some of the restrictions so that they eventually cross a specific threshold or line. And that may take some time. That may take, months, possibly to a year after that. Now, that's not to say that we're going to be living in the same situation. It just means that there's still going to be some measure of restriction, some measure of precaution that needs to be taken, whether it's masking, distancing, whatever the case might be. But at some point, hopefully, and I'm hoping by the end of next year, if everything goes well, we'll have an interesting Halloween and an interesting Christmas this year, but maybe we'll be hopefully having things that start to resemble what we remember from 2019 in the back half of next year. At least I'm hopeful for that.
Thank you, Dr. Lowe. We'll go to our last question of the night. Helena Lewis, are the increased numbers we are seeing now related to Thanksgiving?
So in fact, actually, the numbers that we're seeing right now are possibly related to Thanksgiving somewhat, but they're actually related probably to a few other factors. First of all, we were seeing, and we were starting to see, at least at the end of September, while we weren't seeing transmission in Peel restaurants and bars, we were seeing Peel residents who had been exposed in settings in Toronto. And that actually was part of the reason why I understood the province's decision to impose similar restrictions in Peel, because people had been clearly going into Toronto, enjoying dinner, nightlife, whatever the case might be there. The question was, if they were going to close Toronto but not Peel in that setting, would they then essentially be incubating of the virus and then actually doing the same thing here in Peel? So I understood that. That was why that happened. But I think so part of it was we were very connected, just given the interconnections between our community and Toronto. We were starting to see some of their rise in our community. I think the other thing was the province had a significant backlog of cases, a backlog of tests that they were trying to drive through. And because then what you're seeing is, as they got through the backlog, we were seeing batches of cases pop into our desks, right? So that was what drove some of the spikes that you were seeing over the past 10 days. So overall, I think it's still pretty early days, but I'm hopeful, just given that we're now getting to about 2 weeks, 3 weeks since the modified stage 2 restrictions came in, that we'll start to see some fruits from that in terms of lowering case numbers. But the big thing I'll say, because I know we're going to close soon, Councillor Medeiros, is there's lots of rules out there. There's lots of talks about regulations, all this other stuff there. If I want to leave you with one thing tonight, the one thing I would say is try to reduce your close contacts as much as possible. Make sure that you're sticking in close contact with your immediate household and your essential supports. For everyone else, everybody else out there, postpone, cancel, move online. And if you have to meet for an essential reason like work or school or education or fitness or whatever it is, then make sure you're sticking to distancing, masking, hand washing, keeping numbers low, and please don't meet them if you feel even like the slightest bit sick. Stay home and get tested instead.
So thank you, Dr. Lowe. So I think what we just heard, that nothing's changed. You've been very consistent what we have to do. There's no magic to it. There's no secret. And we are where we are right now, but it's important that we maintain and follow those guidelines. Dr. Lowe, so just finally, if anyone tonight or anyone watching us on video later have any questions or want to reach out to Peel Public Health, what's the best way to do it?
So you can always get information anytime on our website at peelregion.ca/coronavirus, or you can also call our call center at 8:30 till I believe it's 5 or 6. I will double check those. I would double check that. It's on our website, and it's at 905-799-7700.
Thank you very much, Dr. Lowe. Stay safe, and thank you again for your continued support to the community. And we really appreciate everything that you do to educate us, to ensure safety, and that we get through this pandemic together. Thank you very much, and for good evening to everybody. Thank you for joining us tonight. And again, it's no secret, social distancing, wear your mask, wash your hands, and have yourself a good night, and thank you very much.
Thanks, Councillor, and thanks everyone. Have a good night.